And in the health center this morning, we're talking about minimally invasive lung surgery. And joining us to talk about this are Drs. Pearlstein and Dr. Santos Krishnan from St. Luke's Medical Center. Thank you for being here.
Good morning.
Let's first talk about, when we talk about minimally invasive, easier to say than do, but what are we talking about here?
Well, essentially, the way lung surgery has traditionally been done is with a large incision. You spread the ribs, you have to get 2 pairs of hands in there. This is the same surgery, identical surgery done, but it's done with minimal incisions and a television camera.
And what are the successes? I mean, are they comparable?
Oh yeah, it's identical in terms of the results. I mean, now they've been looking at it for up to 12 years, and if you can do it, if you have the skills to do it, the success rate, the post-op complication rate, the overall survival rate is exactly the same.
And the reasons for lung surgery typically are lung cancer. What are some of the causes?
Smoking is the #1 cause of lung cancer, and then after that things like radon exposure, asbestos exposure can also cause lung cancer, but 85–90% of all lung cancers are caused by smoking.
And when we have this kind of surgery, again, what's the outlook for patients? What are we seeing? We're seeing shorter hospital stays.
Right. Well, you know, I mean, ultimately we do surgery to cure lung cancer, okay? I mean, there's this overall perception in the community that lung cancer is a death sentence.
Yes.
If we catch lung cancer early and we operate on it, we have over an 80% cure rate.
And who's the candidate? Who is a best candidate for the surgery?
I mean, in our hands, it's probably anybody with a lung tumor. I mean, there are some that are very centrally located, meaning near the heart. If they've had preoperative radiation therapy, then it's hard to do. But pretty much anybody we can get through the operation, yeah.
And what are the symptoms? Because we've learned from people like Dana Reeves, who, you know, very high-profile case, is that you don't have to be a smoker to develop lung cancer. Are there symptoms? How do you know?
Well, unfortunately, most of the times when people have symptoms like coughing up blood or changes in their voice, it's an advanced lung cancer. So the best way is for smokers either to stop smoking or to talk to their doctor about getting x-rays and CAT scans beforehand to diagnose this before they cause symptoms.
And as always, find out what's your facility, your health care provider, the types of procedures that they're able to do, because this is still kind of new, the minimally invasive surgery.
Right, right. And only 5% of the lung cancer surgery in the country is done this way right now. But I think that that's sort of going to expand as the years unfold.
And we're fortunate that at St. Luke's, as usual, leading the way of innovation here in medicine.
We certainly operate there.
Thank you both for being here. And for more information, you can call St. Luke's Medical Center. Their second opinion line, it's 1-800-649-6892.